So what we're gonna do now is the research buffet. So if you guys want to stay sitting, you can. If you want to stand up and talk or whatever you feel comfortable with. The routine IVs. So whoever has that, if you just want to share.
Was that yours?
Just kind of share a little bit of like why they do it, why.
He was
What are the
making me
risks?
nervous, so I started
So you
researching
did
it
it
this
for
morning
him?
in case he, but he has like,
Awesome.
because I couldn't find too much on it.
Yeah. You're good.
I just wrote some of the pros and cons down
Mhm.
here of some of the pros of routine IV are it helps keep you hydrated, reduces the need to be stuck with a needle repeatedly when they need to medicate you, permits you to have an epidural. And then a few cons were just the initial insertion can be painful. IV lines can get tangled while moving around and get in different positions. May prevent you from opting for a shower or tub during delivery. But then it had something else too, where you don't necessarily, IV is not your only option. As far as staying hydrated, you can drink clear fluids to keep you hydrated without having to be stuck with an IV. Or you can limit the chances of getting tangled in the IV lanes by getting a catheter to just do medications when as needed.
That would be up here, right?
And I think IVs also fill you up with fluid a lot that you got to get rid of. It can take a long time to get rid of the stuff.
Yes, that's very good. And that whole thing, too much fluid is a big thing because not only does mom get too much fluid, but think about, okay, so baby's in there, baby's getting all that fluid too. So what happens, baby gets born, they weigh baby and they're like, okay, baby weighs this much, baby loses that fluid. You know, the fluid works itself out. Now all of a sudden they're worried because how did baby go from weighing this to now only weighing this amount because baby has so much fluid and then mom also has to work out all that fluid also. So there's a lot of times the fluid is retained.
And then they're concerned about is he getting enough of milk because he dropped that much weight.
Yes.
That's how recent was. His labor was really long. And I had pregnancy carpal tunnel before I went into labor. You know what that is? Right? Slightly, not much, just a little. Till they had to get this certain amount of fluid and what do they do for herpes strep?
Like they'll give you an antibiotic.
Antibiotics, and they had to do 3 doses. I forget. Anyway, it was crazy. I could not, like after he was born, I couldn't use my hands because I couldn't feel them. Like the carpal tunnel, like my fingers were just.
Wow. Yeah.
But I didn't know like that it affects the baby that way. I was actually when I was researching for him this morning.
But I didn't take any of your information. I did my own research.
That they didn't realize whatever. That there's something like overhydration during labor.
And what's really amazing is a lot of the locations surrounding Lancaster County, they have very much been like, we want to serve moms and stuff, and so they let you drink water and stuff versus back in the day they give you some ice just vanilla. They'll let you stay hydrated. You can have your port, you know, in case it's an emergency that they need to use it for something.
Oh,
But they'll
so
let
they
you-
don't, like you don't always have to hook up to
You don't always have to, like
IV
a lot of
if you're doing
times.
a low risk.
Yeah, a lot of times they'll just like put the port in, that way it's easy access if for any reason they need the IV. But a lot of times they will let you stay hydrated on your own, so you can drink and stuff through labor.
What else did I learn? Oh, there was another thing that the reasons that they put IV in is for C-section reasons. They don't want you eating, so they put IV in. And so the mom's kind of hungry while she's in labor and she doesn't have the max amount of strength and energy
Yeah.
that she would if she would be consuming healthy food.
Yes, absolutely. So the next one, Gianna was going to share, but she got called into work. So she's like, I can't come. But hers was the forceps and the vacuum delivery. And I really wish she could have shared because she said on my first one, she's like, they used both of them to get her son out. But what they use them for is normally if baby is in like fetal distress and they like, baby needs to come out now. Instead, it's kind of like an option before they go into C-section where it's like, okay, you know what, fetal distress, let's try the vacuum extraction or the forceps. The forceps, in my mind, I think of like the metal salad tongues. So that just kind of gives you like a visual of what it is. So it's just kind of like a salad tongues where they go in, and so the risk of that is it can cause damage to the baby's head, like it can kind of scrape baby's head, and also it can hurt mom. And the vacuum extraction is less risky, but that can also, because it's like hooked to the top of, think about the top of baby's head, it can cause like internal bleeding for baby. And that just puts, you know, mom and baby at more risk for infections. Infections and damage, and it can cause bumps. The vacuum can cause kind of like a cone head bump on baby's head.
I know, I was just thinking, like, I'm probably horrifying them soon. But Gianna, like, I wonder, do you know, did they use something like that? Are you sure? She had this big bruise on her head. So.
I was gonna say, you would know if they used, because the
They
vacuum
would have used
thing
the
is-
vacuum if they would have used something.
Yeah, and most times if they use one or the other, it's
something
vacuum.
little towards the.
No, I don't think it was.
She had claw marks on her head from the midwife trying to pull.
Yeah, because
Oh.
I think,
And then she
yeah,
had
'cause the
this
midwife took her,
horrible like,
Oh.
the midwife took her
bruise
hand
on
really cold.
Mhm.
her head for 6 weeks, I think.
Okay.
So,
Yeah.
like you could see it go down.
I don't think they used anything.
I can't remember.
Yeah, because it can cause that.
I just remember the bruise.
Yeah. The next one is the electronic fetal monitoring. Go for it.
It is used to track the heart rate of your baby and the duration of the contractions. It uses the use of the Doppler allows your midwife or OB to see what is going on inside from the outside. Main benefit to electronic fetal monitoring is that it allows us to know if there's any abnormalities or problems during the different stages of pregnancy. And an alternative to using this would be to use a stethoscope past 28 weeks to get the heart rate.
So pretty much it's kind of like we said, like it's either the two belts or the internal monitoring, which is rather obviously you're going to have to be hooked up to some machine that's telling you that information, so that's going to limit your movement. So if you have something that the midwife, you know, can use the Doppler and just check baby's heart rate, but you don't have to be connected to anything, so that allows you to move around better. All right, good job. The next one is induction or augmentation of labor.
I don't have
You don't, Dorothy has
Okay.
that one. Awesome.
Oh. And like all of learning all of this is such an eye opener because like I begged to be induced when I was pregnant with Grayson
Mhm.
because I was so tired of being pregnant, and that's the #1 reason for induction is to have a planned due date to be able to take off of work and get a sitter.
Mhm.
So it works out great that way. They also use induction or do induction for preeclampsia, which is high blood pressure, swelling, or protein in the urine. Something I've never heard of before is IUGR, which is inner uterine growth retardation. The baby's not growing properly. Do you, like, you know all this? Like, is this,
It
like,
would be, so like, something's like wrong with baby that they're like, okay, baby's gonna be safer on the outside versus on the
and
inside.
that's also, low fluid would also be that. Premature rupture of membranes.
It's not the kind of problem
They
you want to go to.
Not that.
Standards, the standard is they would induce you within 12 hours after your membrane ruptures. You don't know labor. Post due date. I only found most of them said 41 weeks is when they induce.
Mm-hmm.
I only found one doctor or whatever that said 42 weeks,
Okay.
which I thought was unusual. So risks of induction. Medicines used to induce labor can cause contractions too strong. Strong contractions may distress or slow the baby's heart rate. The uterus needs to contract, but you also need to relax. While relaxing, the blood flow brings oxygen to your baby. Inducing can increase the chance of your baby having problems with the umbilical cord. I did not know that either, and I didn't do any more research, so I don't know.
Yeah, so it's just kind of the whole thing where it causes contractions stronger than like what your body normally would, which therefore causes stress on the baby, which can cause like all those
Okay.
problems.
Sometimes being induced doesn't work, and then you end up with a C-section. This was fascinating. Most times, moms that come in to be induced come in the night before or at midnight to put a cervical softener in if you're not ready to be induced. And then they don't sleep well, and by the morning till they start her own Pitocin, she's tired already. And tired mama gets an epidural, which slows down her labor and also eliminates moving around.
Very good. You covered that very nicely. And now we'll hear from you.
Okay. I have a episiotomy, which I did not know anything about. I was like, oh, what's this going to be about? And then I looked it up, and he like looked over and he was like, what is that? So basically, because there were pictures, it's an incision done to the perineum, is that how you say it? By a midwife or an OB during stage 2 of labor. And they do it usually to help get the baby out and to prevent tearing. They say it's like a more controlled way of doing things. I said that. And I read that they do it too because when they make the incision, it's easier to repair versus the natural tearing, which could be like, you don't know what's going to happen. So, and then I also read that it could be necessary if the baby's shoulders are just too broad to get through, or if your OB has to use forceps. So I don't know if that's still something that they do, but
A lot of times, like forceps, they don't use anymore.
Yeah.
So, yeah.
yeah. Well, I read too that it's not as common to do the episiotomy anymore either. So
That's correct.
it's interesting.
Do they like numb you before they do it?
That depends where you're at. A lot of times, they don't.
It's like a really quick, like
Like, it's
okay, we
more
need to
like-
cut and go.
Yeah, it's more like a thing where baby needs
I'm
to
like-
come out. Let's cut. Yeah.
Yeah, it's interesting.
Wow.
But the benefit is having control over the situation and reducing the chances of hemorrhage, asphyxia, and birth trauma for the baby and for the mom. So maybe if they do it, it doesn't hurt as much. I don't know. Sounds horrible. Okay. The main risk to doing it is swelling, infection, like any wound. It said painful intercourse for up to 18 months postpartum, which is like pretty long. And then if they do it, it could become even bigger during delivery of the baby, and so then it could just be like a whole mess and you just have one hole, which would be horrible. And then another thing I read about was that that if they do the episiotomy and then you tear more, it could tear muscle, which is harder to repair. Less than 10% of pregnancies had it done last year in the United States. And then the alternative would just to be let your body run its course.
Very
Do
good.
whatever.
Yes, you covered that very nicely.
Thank you.
And one thing that is amazing is it is not near of a thing like it used to be. Like you said, the reason is like if baby needs to be born and you have to pick episiotomy or C-section, obviously you want that episiotomy. But what happens is, okay, I'm gonna hold this paper here and I'm gonna try to rip it. And if I tried long enough and hard enough, I would be able to rip it. Now, let's just get a little episiotomy going on. I can rip really easy. So that's what happens if you get an episiotomy. A lot of times you're gonna tear pretty bad too, even
Even
with though-
the episiotomy.
yes, even though you had that episiotomy, it just kind of makes it that it's, okay, you've got the cut now, so it just makes it easier for you to tear even more. Which then is a lot longer, it's very painful for mom, and she's gonna have a lot longer recovery time. So, awesome, you guys covered those very nice. Thank you so much for helping me with that. So, we looked at all of that, and now we're gonna talk about a C-section, cesarean birth, which is where they make an incision in mom's abdomen through her uterus, and baby is born surgically through that incision. 1/3 of births result in C-section, even though it should only be 15%. And what are some reasons that a C-section is good, a good idea for a C-section?
Just the baby is not coming out and the heart rate drops and becomes like a life or death
Breech.
Yes.
thing. Oh yeah.
The true fetal distress breech, yes. Another one is placenta previa. So that would mean the placenta would be the first thing coming out, which would not be a good thing. So if you have complete placenta previa at term, that would be another good reason. Abrupted placenta, that means your placenta tore. True fetal distress, true CPD, which is baby's head truly cannot fit through your pelvis. So if you have true CPD,
How do you know
want
that?
That's something your care provider would assess and be able to tell. If, like you said, the breech, if you had a prolapsed umbilical cord, that's kind of like where the umbilical cord would be coming out first too. If you had herpes, and if you had a uterine rupture. So those would be all reasons that it's like, okay, you know what, a cesarean would be a good option. Some of the risks are for baby. Baby a lot of times has more issues with breathing, which will have a NICU. He'll be in the NICU longer. What are some ways that maybe a cesarean birth could have been prevented, where it wasn't maybe the best option? Yes.
Pitocin.
Yes, Pitocin. So you get Pitocin, the whole epidural thing being confined to bed. So that puts mom, you know, we've seen in the clip that put mom at a greater risk for a C-section, which maybe some of those could have been avoided. Fear, the artificial rupture membranes, it's kind of that whole cascade thing, where kind of one thing leads right to the next. Dietary factors, smoking and drug use. So we want to kind of pause a little bit from all of our pain medications and epidurals and C-sections and everything, and look at preterm labor. So usually, like we talked about before, labor has signs. So preterm labor, and that is labor before 37 weeks. And if you have any of the following signs, we say definitely contact your care provider. So if you're having contractions, if you're having them at least 6 in an hour, contact your care provider. Quote, not like your Braxton Hicks ones, but like something that you can tell feels different. Because you're probably having Braxton Hicks and you're like, oh, I'm not 37 weeks. Or past 37
Well,
weeks.
what's the difference between Braxton Hicks and normal?
So you're going to be able to kind of feel, because a lot of times Braxton Hicks are more like on the side versus the true contractions, they're gonna find, like, they normally kind of start at the top and kind of go down over your uterus. It kind of like tightens up.
Okay.
So if you're having those, or you're having like a restless backache that even though you're changing positions or took a nice warm shower or something, it doesn't let up. If you've had like an increase in your mucus discharge, where it's like also it's like, okay, something really is different, just let your care provider know. And always moms, we say, have that sense like, okay, something's just not right. If you have that, just let your care provider know so they can assess you and see what's going on. So we talked about the pain meds, preterm labor. Now, if you do get transferred to a hospital, there are some decisions you are going to have to make about your newborn baby. So after baby's born, they put them up on the chest. They're going to do the APGAR scores, which are, they kind of assess baby, what is baby, how's baby breathing, the color and everything, and they'll give a score to that just kind of to keep track how baby is doing. But after baby's born, if you have a baby boy, you will have to decide if you want him circumcised or not. And if you decide to go with it, there is options. You can have it done in the hospital before you leave, like on day 1, which can be kind of painful for baby, and baby's trying to adapt to being like out of the womb and adjusting to earth. And so it can make like nursing and stuff harder, but you can, a lot of times OBs will let you wait to day 7 or 8, so baby's kind of a little more established, and they can, and a lot of times they will use a numbing agent, which will be a better experience for baby. Cord clamping, so after baby's born, after placenta and everything, you do have an option, and most of the people that work in this area, they do delayed cord clamping, but just if that's important to you, let your care provider know. So you think about your placenta and all the blood that is circulating for baby, so if you just wait a little bit, all that blood gets to go to baby instead of clamping it before the blood was able to go to the cord to baby. Does that make sense? So in other words, you can just be like, hey, can we just wait a little bit till the cord is done pulsing, and then clamp it. And dads, you guys get the option if you want to cut it or not. So you can help with that. Vitamin K shot. They will give you the option of that. It is pretty routine. And what it is a synthetic vitamin K, which that is used, babies at first don't have their own blood clotting, and so that helps them clot their blood. So if baby has a traumatic birth, they'll probably recommend that. And we say vitamin K, talk to your care provider about that and kind of assess everything and let them help you make a good choice on that. And you can see what your options are on that. The eye drops. Do you guys remember after baby was born, the eye drops?
I don't remember what they were for, or I just know that they did them.
Yes, so usually within an hour after baby's born, they'll do some eye drops, and it's to protect them against any infection in the birth canal. This is a thing where it kind of makes baby's eyes blurry, so baby can't like see you, and we kind of assess like, okay, what's the good, what's the bad of it. And if you don't, I'm gonna look here so I tell you this all correctly. If you do not have syphilis or gonorrhea, you do not have to get eye drops, because that's what it is to protect baby against. If you have that, they'll kind of, throughout your pregnancy, like they'll be able to tell you if you have it or not. So if you don't have that, you can decline it. They'll just ask you to sign a paper. And some moms are like, well, what if baby gets an infection? If you see baby has any eye infection, it is still treatable. So just information.
How long is the baby's eyes blurry, and is that the only side effect from the address?
It has other side effects, but mostly like the most common is like the whole, the blurry vision. I don't know exactly how long, like what for time frame that baby has blurry vision. I'm not sure on that. So yeah, you can consider that. And sometimes moms are like, they still want baby to have it, but they're like, hey, can we wait till baby's like sleepy, ready to fall asleep? That way it's not those first bonding, the couple hours right after baby's born, the bonding where baby wants to look at mom and you want to, bond. So you can also, if you do want that, you can wait a couple hours for that. They will offer you the hepatitis B shot. This is an immunization for liver disease. So to kind of get a grasp of what this all is, it's pretty much for baby looking forward a couple years to if baby has sex with somebody that has hepatitis B, it's going to protect them against that. So there is side effects for baby, and it's something you have to weigh out the options. If you or your spouse does have hepatitis B, then baby wants to have it. And hepatitis B is something, if you have it, you are going to know. It's not like one of those things like, oh, do I have it or not? If you have it, you'll know. So there is side effects to the shot. So I say weigh out your options on that. They will do a blood test. This is a mandatory test. And that is, they're going to do a little heel prick. And they're going to test for PKU, sickle cell anemia, hyperthyroidism. Those are all quite rare, but if baby has them, you want to catch it as soon, just because it can help prevent some very serious health issues later in baby's life. Baby is going to come out. Some have a lot of vernix, some have a little, and what it looks like, honestly, is vanilla yogurt. So sometimes babies are covered with them, sometimes it's not. It is something very healthy for baby's skin, so if you want to delay the baby's bath, that is an option. And some moms even like to just like rub it into their skin because it's really good for them. If you do bath them, baby will lose heat. And right after baby's born, they'll sometimes suction them out a little bit. Babies can be born with cone heads, some like birthmarks, stork kisses, that type of thing. So just so you know, it can look a little covered in yogurt. Just think of that. Sometimes they do have a little bit of pimples. So all of that can kind of feel like, oh my word, what are we doing? All of this heavy information. Just because of time, we're not going to do the relaxing tonight. But since the guys are going to be driving, I want moms to relax. Like, practice it on the way home while you're driving. Just because I know this is kind of...
for an hour and I
Yeah.
for 10 minutes.
Just to kind of like take a deep breath. This is some stuff. Try not to let yourself be fearful of it, but just kind of be like, you know what, just remember that 96% of pregnancies do not need any of these interventions or pain medications. So just kind of keep that in perspective, and just, I say just kind of keep thinking about it and just kind of studying yourself to see what helps you to relax. And even when you're getting into things that are starting to stress you out and tense you up and stuff, I want you to start practicing that breathing. Even if you're not stressed out, practice that breathing. Just to get you familiar where it's like, it's second nature for you, just to do that breathing. And that way then when you're in labor and things are getting intense, you can remember to do that breathing and remembering what's going to help you relax. Was there any other questions on any of all that information that just got thrown at you? Awesome. So next time, it's going to be a lot happier of a subject. So next time is going to be postpartum, how to take care of yourself and the newborn and breastfeeding. So that's going to be next class. We're going to, so last class, you guys completed birth class, and we're going to have like a little extra celebration because you guys completed it and you guys are closer to your due date. So that's going to be fun.
Still pretty much. It feels like a long time.
Yes, so we'll get all of that.
her coughing.
Need more sleep, that's what I need.